Little girls look up to their daddies as heroes, but no dad can even compare to my dad. My dad was my rock when I needed help and my big teddy bear when I needed to snuggle. He is the greatest man I know. In my eyes, my dad was perfect. He had one major flaw, though. He did not take care of his health the way he should have. All his life, he was an electrician, and while he was working, he would stop at fast food restaurants like Burger King or McDonald's for his meals. We also had a very busy family, and eating together at the dinner table was a rare occurrence. We would frequently stop and have fast food or eat at a restaurant for dinner. My dad was overweight, had high cholesterol and high blood pressure, but never saw a doctor. There are many different problems that can be caused by these 3 risk factors, including cancer, diabetes, and heart disease. My dad was diagnosed with atrial fibrillation, also known as AFib, in October of 2012. AFib is where the upper and lower chambers of the heart beat at different rates. Some people experience a racing heartbeat sensation, chest pain, shortness of breath, and other symptoms, while others experience no symptoms at all. AFib is dangerous in all cases. Even because the upper and lower chambers of the heart beat at different rates, the blood in between the chambers pools and clots. Blood clots can lead to stroke when it gets to the brain. Most patients who have been diagnosed with AFib are placed on a blood thinner like Coumadin to prevent this. After my dad was diagnosed with AFib, he began an aspirin regimen and took medicines for his blood pressure and cholesterol. He started eating healthier and working out, but it was too little too late. On January 31st, 2013, my dad suffered a stroke in his home. The stroke was on the left side of his brain, paralyzing the right side of his body and taking away his speech. When a blood clot hits the brain, it cuts off blood supply to an area of the brain, denying the brain of oxygen. From the onset of a stroke, timing is absolutely critical. So what are the signs of a stroke? Follow the FAST method. F stands for face, a drooping smile. A is for arms, weakness or paralysis in one arm while the other has normal function. S is for speech. If they can speak at all, speech might be slurred. T stands for time. It is time to call 911 immediately. The sooner EMS can arrive on the scene, the sooner the patient can get to the hospital and the right medicines can be administered. Doctors have 3 hours from the onset of a stroke to get a drug called TPA into their systems. This is a blood thinner that begins working immediately to break up the clot and restore blood flow to the brain. The sooner this drug can be administered, the less brain damage will be done. My parents are fortunate to live in a busy suburb near one of the best stroke hospitals in the nation. My dad was immediately rushed to Edward Hospital and had TPA in his system within 1 hour of his collapse. While the TPA was working, we watched him go from unresponsive and confused to responsive, tracking with his eyes and able to respond to commands. However, he still could not move the right side of his body. Stroke affects the function on the opposite side of the body. However, human brains are plastic, which means they can relearn how to do something in one part of the brain that is a function of a different part of the brain. This is where intense therapy comes in. Every day, my dad has speech, occupational, and physical therapy. He has to work hard each and every day to do tasks that most people take for granted, such as sitting up, in bed, getting dressed, and brushing his teeth. This stroke has been a wake-up call to our family, and me especially. I've had many habits similar to my dad's. I'm busy, so I frequently stop for fast food. Since my dad's stroke, I've made some major changes in my life. I take daily supplements, watch the food I consume, work out more often, and try to do other things to help me with my overall health. Preventing disease is much easier and less expensive than treating the disease. Living a healthy lifestyle not only prevents disease, but it also prolongs your healthy years. Healthy food and gym memberships might not be as cheap as the dollar menu at the fast food restaurants, but the cost of living healthy now sure beats the medical bills piling up at my parents' house.
Let me help you all I can while I'm still in this world. What will you do